In this last section, our last module of this course, we're going to look at some of the potential considerations before someone undergoes bariatric surgery and after the fact as well. Okay, and we're also going to look at some financial considerations with bariatric surgery here in Canada. So each clinic that offers bariatric surgery is going to have their own kind of prescription as far as diet goes, but these are from the Oxford Bariatric Service, and it gives you some insight into what is prescribed for an individual before they get bariatric surgery. It's not just like, oh, I'm going to get this done and I get it right away and I don't have to change anything first. First thing to keep in mind, here in Canada, it's usually about a 2-year wait, okay? Second of all, before you're fully eligible, there's usually a weight loss that is recommended, and they're also going to check for kind of other health-related factors, both physical and mental, that could potentially affect the surgery, okay? So one of the main goals with a pre-operative diet is to reduce the overall size of the liver and to reduce liver glycogen, basically so the liver is a little bit more, I don't want to say malleable, but movable, so we can kind of move it to the side to be able to do the procedures we need to do, okay? So you'll notice that there is a focus on water and there is a focus on reducing weight as well. Avoiding alcohol is a big part of it, and taking a daily vitamin mineral supplement. Carbohydrate recommendations are actually quite low, 100 grams. In my first year students, when they do their diet analysis, most of my first year students are in like the 400 to 600 grams of carbs a day. So that's quite low and usually is enough to get someone into ketosis as well. So it's a low carb diet, usually low in fat as well, and a little bit higher in protein, but it's quite restrictive. And again, each clinic will have different recommendations, but usually we don't recommend less than a 1,200 calorie a day diet, depending on the person. But this is quite low, especially for someone with obesity, right? Who has potentially all these overacting appetite signals. Okay, so again, not something to be taken lightly. So again, gives you a bit of an idea of what a menu might look like before someone has bariatric surgery. So 3 tablespoons of cereal, or 1 slice of toast with a scraping, a low-fat spread, an apple, 2 egg-sized potatoes. Like, it's really small, the amount of food that is typically prescribed. Okay. That said, a lot of times meal replacements are used, and not just for pre-bariatric patients, but also patients with obesity or people with obesity might find a lot of success, weight success, if that is their goal, with using meal replacements. Okay. So this is actually one of the ways that meal replacement companies make money. They often market to older individuals, but they also market to individuals with obesity. Okay. So this is from the MedWeight clinic, who we heard from this semester, and this is some requirements for bariatric surgery that they give to their patient for consideration. Someone's going to need to quit smoking, which is not a small task to ask someone of if they have smoked all their life. Okay, they have to stop drinking alcohol. Okay, they have to evaluate and diagnose any sleep disorders. Their diabetes and other kind of metabolic factors have to be under control. They do a psych evaluation as well. And one of their main goals is to kind of assess, what is going to impact their ability to cope through surgery and afterwards as well. Okay. And be aware that you will be required to buy and take for the rest of your life certain nutritional supplements, such as a multivitamin. Okay, so these, depending on the particular type of surgery they get, there are a number of deficiencies that creep up. Okay, so iron, B12, D, E, and K. Notice these are all of these are fat-soluble vitamins. So of course, because lipid digestion is going to be compromised, since bile in a lot of these procedures doesn't get to work on food till way distally in the small intestine, that's going to impact lipid digestion absorption, and it also impacts the absorption of lipid vitamins, our lipid-soluble vitamins. Okay. So you're going to have to take vitamins for the rest of your life. And something else to consider is that when someone undergoes bariatric surgery, they might lose a lot of weight, but they might have a lot of excess skin that is also left over. And no medical plans in Canada cover the removal of that excess skin. And that excess skin can have various physical effects and psychological effects as well. So for one, that excess skin can cause sores, can cause rubbing. It also, like if someone's trying to, let's say, be active, think about carrying around that extra skin and how that could affect their activity patterns. And of course, there's a psychological aspect of carrying that extra skin around and maybe the self-esteem or body image issues that brings up. Okay. Something else, so that's not covered, but people can do elective surgery, but they're going to have to pay for that elective surgery here in Canada. Okay. There's also, stay in the hospital time as well. Caffeine needs to be decreased. Carbonated beverages need to be decreased. So usually alcohol consumption goes down a lot after these procedures because they cannot tolerate alcohol as well. Okay, hair can thin out, and like I said, excess removal of skin is not covered. Okay, something else to consider is the psychological impacts of losing a lot of weight, and this comes from the blog of Yanni Friedhoff, who's one of the leading obesity medicine doctors here in the country, and blog where I don't know if he still keeps it up, but it's worth checking out. But he had a guest blogger, Carrie, who talked about some of the unexpected changes that occurred following her procedure. And you can look through her quotes, but one of the main things that kind of comes up is, it pissed her off how people changed the way they acted towards her. And I lost a lot of weight when I was in my 20s. And I remember that people that used to be kind of mean to me were nicer to me after the fact. People changed the way, not just romantically and romantic interests, but also people were just nicer to me once I lost weight. I had a friend that lost a few teeth and, attractive guy who lost a few teeth, and we kind of bonded over the fact that we were both I can't believe how much nicer people are to you when you look a certain way compared to when you don't look a certain way. Okay. Also, the comments that people give, is you don't know how it's going to affect you until it's in front of you. You look so much younger, taller, better, prettier, smarter. I know when I lost weight and people told me I looked prettier or better, I'm like, what were you thinking about me before? Can't kind of help but think that. You're not going to lose more weight, are you? You're done, right? Maybe you should eat more. You don't want to lose too much. And comments like this, I don't think people realize how that can be internalized for the person. I wish I could have that surgery. It's such an easy way to lose weight. I would not agree with that statement. Okay, although some people see it as an easy way out, as we've just explored, there's a lot of considerations and there's a lot of things a person needs to do before they're even eligible for that surgery, in addition to waiting about 2 years to be able to get it here in Canada. Okay, which brings us to the 2019 report card on obesity treatment that was put out by Obesity Canada, who we've talked a lot about in this course. So they talk about the results from bariatric surgery and how much it can both reduce weight but also reduce medical complications too, and just comorbidities too. One of the things they highlight is the amount of people who are eligible for this surgery who are actually able to access it is 1 in about 171.5% basically of people who are candidates for bariatric surgery actually are able to get it. And it really depends on the province. So I'm going to just go to this next slide, because this first of all highlights that bariatric surgery is not available in every province. Okay, and for instance, Prince Edward Island, PEI, it's only been available since 2014, and they only did one surgery in 2014 and one in 2017. Okay, you'll notice that unsurprisingly, we do higher numbers of surgeries in Quebec and Ontario. I say unsurprisingly because those are our biggest provinces here in Canada. In BC, We do about 400 surgeries a year as of 2017, 2018. You'll notice a general upward trend in the amount of surgeries that are done per year, but it really, again, depends on the province as far as access to care, and not every province is going to have the same types of surgeries available. It's not just like you get to pick, it's usually what particular clinics do and what's kind of available to you there. Okay. In addition to the fact that they don't perform a lot of these surgeries in general, there's also something to consider, which is the wait time. The wait time between the referral and consultation, which is the biggest part of the wait time, can range from about, what's the smallest one here, 8 months to up to 84 months, okay, or 106 months out in the Maritimes. Okay, and although there is some improvement in some of these, the amount of time that it takes between getting referred for bariatric surgery and actually going through it, it's really quite a long time. So it's one of the things that Obesity Canada is really advocating for, is to get obesity recognized as a disease, to potentially get more people performing this surgery and a more, streamlined delivery or pathway towards actually getting the surgery done. So this is from that same report on obesity, and one of the things I wanted to highlight here is, although access to bariatric surgery has improved slightly since the 2017 report, which was their first one, it has not kept pace with the increasing prevalence of severe obesity. Okay, plus the wait times are really long. And yeah, of course, during this time, an individual with obesity can use lifestyle management, they can use behavioral modifications, they can use pharmacotherapy if that's not prohibitive financially. But quite honestly, for some people who those other strategies only work so much for, bariatric surgery is potentially not just a life-saving, like physical life-saving, but a mental experience with this world-saving procedure. And the number of improved comorbidities that come out of bariatric surgery is another reason why Obesity Canada, obesity doctors are advocating for more of this, okay? But again, at the individual level, it's really about figuring out what's best for that individual, and that may or may not include bariatric surgery, okay? Because the wait times for bariatric surgery are so long, and not just bariatric surgery, but other procedures here in Canada, there's a lot of medical tourism that occurs. These are people that go down to other countries to get certain procedures done that are either not done in Canada or that are a lot cheaper or quicker than what is an option in Canada. Mexico is a popular destination for Canadians with bariatric surgery. The issue with that is that you don't know what you're getting. And if they do a crappy job, especially if you don't pay much for it, chances are the job is maybe not up to maybe the standards we might see in Canada, but again, it would depend. Individuals, what often happens is they come back from this medical tourism with complications, right? And then that does become a burden on the Canadian healthcare, because, that's something that would be covered by Canadian healthcare. Okay, so just to highlight that, people will go to other lengths to get this done if it isn't covered, okay, and with other complications. So basically, a kind of a summary of what we talked about with bariatric surgery. It is relatively safe, but there are complications and there's things to keep in mind. But it is something that not only reduces fat mass, but also can improve a number of risk factors for other diseases as well. Okay, and helps to manage things like type 2 diabetes. It's really good for helping to reduce or more manage blood sugar. That said, it is not an easy way out. Significant lifestyle changes need to happen both before and after the procedure goes down. Plus, there's the excess skin that can happen if someone does drop a significant amount of their weight. Some promote more weight loss than others. That said, like we said before, weight loss is typically more significant at the 1-year mark, and then we see a trending upwards. That said, if good behaviors are maintained, then we typically see that weight loss can be more so maintained. But even still, we do see a bit of an upward trend in weight after that 1-year period. Okay. In general, Canada has poor access to these surgeries and poor follow-up care, and removal of excess skin is not covered by provincial care. And this is one of the things that Obesity Canada, like I said, advocates for. So that brings us to the end of this course, and we will talk a little bit more about this in class this week, but it has been a pleasure to teach you via this medium, and though it's more fun when we meet in person. So I will see you this week in class.